Was in palliative care. Today we are going to discuss on mental health. We have Dr. Anilkumar as our faculty here. Welcome, Doctor. Welcome on board. And Ms. Manisha is here for a brief introduction of our faculty. Welcome, Manisha. Manisha, over to you.
Hello everyone, good afternoon. It's great to see all of you today. Welcome Dr. Anilkumar to the session. We are so pleased to have you with us. So for a brief introduction, Dr. Anilkumar TV is the professor of psychiatry at Government Medical College Trivandrum. He has more than 22 years of experience as a PG professor. He also has a great interest in child psychiatry. He's in charge of child and adolescent psychiatry services in Medical College Trivandrum since 1997. He is also an expert in perinatal mental health, school mental health, and college mental health programs. He's also the founder secretary of Manasa Self-Help Group for Recovered Patients and Family Members. And he also has a lot of publications in his name. I know words wouldn't be enough to describe your achievements, sir. So we are very pleased to have you. Please take over, sir.
Hello, good evening, good afternoon. Am I audible?
Yes, Doctor, you are.
So let me share my slides also. Is it moving? That slides are moving?
Not yet, sir.
Is it okay now?
Sir, your slides are not visible, sir.
Pardon?
Your slide is not visible, sir.
I think there are members from outside Kerala also. So I'll try to use English and also in between Malayalam. And I will use the slides to elaborate my points. You can stop in between and we'll discuss, not take it as a class, take it as a discussion, because these are all common sense things only in mental health. All of us going through the difficult times in palliative and the COVID time, and also in mental health issues in cancer, palliative care. All of you are familiar since you have chosen this area to work. So all of our patients, most of our patients are going through difficult time, stress, anxiety, depression, and the difficult times in life. So mental health is very important. So I will try to establish the importance of, or once again, restate the importance of mental health and identify any treatable conditions like depression or severe anxiety, sleep disturbance and all. And is it possible to offer some specific interventions, or when medical help, sometimes when they may need medical or drug treatment. I hope there are doctors in this group. Currently, any doctors here joined at this point of time? Will you please introduce yourself so that it will be easy for me to communicate? Any doctors now in this group? Hello?
Yes, sir. We have a few doctors, Dr. Usha Narayan, Dr. John C.
Will you please switch on your camera and introduce yourself?
Hello.
Yeah, Dr. Vinuta.
Yeah, good afternoon, doctor. I'm Dr. Vinuta Raman, anesthesiologist. Now I'm working as a palliative care physician.
Okay, where are you from, madam?
Good afternoon, sir. I'm Dr. Usha Narayanan. I'm a dental surgeon and counseling psychologist.
Which state, Kerala or outside Kerala?
Yeah, I'm in Kerala, sir. Ernakulam.
Ernakulam. Vinitha, madam, where are you from?
I am from Mysore, sir. SUIM palliative care. Yeah.
Okay.
Good afternoon, sir. Myself, Dr. Mohan from Trichy, retired medical officer from PHC.
Mohan, sir. Okay.
Dr. Mohan.
So currently, how many members are there? Do we get enough time to introduce all of us? I don't know. Anyway, we'll try to make it interactive. Please write in the chat any questions or so that we can interact even without much discussion, because time is limited. So the outline of my presentation will be, we'll spend some time for self-introduction. Then I'll try to introduce mental health importance in palliative care. Then the positive mental health, that wellness concept, that how to maintain wellness, that is positive mental health as a part of physical health, social health. So mental health is also very important. Then brief discussion on anxiety, depression, identification of some suicidal risk and how to intervene. And intervention as a part of the psychological support or a therapy, a solution-focused approach. So this is called a new wave of therapy, a solution-focused therapy kind of thing. Instead of going into digging into the problems, we are how to find solution for the problems or the situation of the client or their family. So it is called solution-focused brief therapy sessions. And we will finally spend some time on discussion, reflection, your opinion and all. Okay. So self-introduction, some of you can volunteer and communicate. So your favorite area or passion, you must be passionate in palliative care. Some of you can introduce yourself and tell about your passion or favorite area of life, area in your profession or work. Or you can write in the chat box. Ongo rehabilitation. Okay. Jarapana Srinivas. Okay. Please, few more response.
We can speak up too.
Yes, yes. Abhijit.
Okay, yeah, my name is Abhijit and I'm quite passionate about making my community aware about the current and social issues that are ongoing.
Very good. Where are you from, Abhijit?
I'm from Navi Mumbai.
Navi Mumbai. Okay. Thank you for sharing. Deepa Jose, enhance mental health of the society. Usha Narayan, madam. Okay. Work in Pali, India. Deepa Jose. Okay. Community mental health. Pain and management. Asking these questions because these are important approach in solution-focused approach. When we interact with our clients, patients, or family members, try to understand their passion, their positive things, their strength, their hobby, and all. So there is a good way of establishing rapport with people and motivating them to do something. Even though they are going through a lot of sufferings, pain, and all, it's good to start with their interest, hobby, passion, and all. So it will give some relief again, relief and hope to work towards in a better future. Okay. So the next point. Okay. So a recent pleasant event in life. You can share or switch on your camera or write. A recent pleasant event which gave you some happiness in your professional or personal life. Even though we are going through difficult times, there are the 24 hours, 364 days are not bad. There are moments of happiness we spend with our friends, family, or with sometimes your patients also give us a lot of happiness. So please share some of your happy moments or pleasant events, recent life. Some of you can share or write. Madam Sharma, mental health awareness in the tribal community, Jharkhand. Okay. So maybe regarding your passion. When we get gifts which are handmade from our patients. Very good. Especially from palliative care. Whenever I visit Palli India, I try to collect the handicraft materials, objects produced, their umbrella, even a simple postcard. So there is a token of appreciation, and also we also feel happy by exhibiting in our room. So it's a good thing. Okay. Okay. So let me go to the next. So one of your skill which appreciated by the positive things, an opportunity to join FCPC course in Palli India, good words from clients, okay, appreciation by others. Some skills which appreciated by others, there is a positive things. So these questions you can use for communicating with the clients also. That's why I'm trying to introduce these questions to you. This positive way of stimulating their maybe well-being or mental health. So these are actually basic questions we used in solution-focused therapy. So instead of asking about what are your problems, if you ask about what are your skills, what are your positive good things, good words from clients, skills, I am approachable. Very good. Manaj Sharma. Okay. Approachable. So listening skills, that is a very important. Actually in counseling, what we are listening skill, very good. Motivating clients, focusing on strength, Binu Thomas. Okay. Jovial. Humor is very important to relieve stress. Detail oriented. Sajjan George. Okay. Detail. Please elaborate on that. Sajjan George, will you please elaborate what do you mean by detail oriented? Sajjan?
I mean, whatever I do, I go to the depth of it, like, going into the root cause of it, going into, not missing anything out, so those kind of things.
Okay, very good. This detailing actually in solution focused also, they also encourage the detailing of the better future. So you encourage them to speak about a happy future within, even though there are limitations, you try to explain, ask the person to explain in detail about the dream, maybe a pain relief, maybe a dream, going to school or spending time with the family, going out to the beach. That may be a simple dream for that patient in palliative care. So you can ask them to detail it. So detailing will give more, I think it will, that theory, even there is a biology, it will make changes in your brain. The neurotransmitter, even that changes in endorphin, dopamine, and even oxytocin, that kind of change, and your brain will become more fresh by detailing into that. So that's a very good point. Observation skills. Okay, good. So let me move to the next point. Dream. Your dream or goals in life or meaning of life, something meaning of life. There should be some dream. Always there should be some dream, something to look forward. Please share your dream. When at this age, we can dream for a better future or a better profession or a better, making people feel worthy, to make difference in lives of people. So Abhijit again, Binu Thomas, making people feel worthy. Okay. Okay. There's the time limit. I'm going a little fast. One thing to change in life. Have you ever thought of making some change in life, the way in which we are, maybe our routine or our behavior, or maybe something we want to make a change. So this is a better approach rather than what are the problems. Instead of, it's a better way of looking at the problem. One thing we want to change. So it's a challenge, a skill we have to learn to make a change. Procrastination. All of us, or most of us, suffer from this procrastination. That may be, even though it is a simple thing, it may be delayed to the last point, making it harder. So helping the way we can. Okay. What do you mean by that? Anima, helping the way we can. Anima? Will you please elaborate? Anima or anima? Anima care. Anima, will you please elaborate? What do you mean by helping the way? Anima, your mic is off. Microphone is switch. Please switch on the weight loss. Weight loss exercise. Even though,
Sir, sometimes we might be in our skills might be inadequate. So when whatever way we can to help others.
our okay, I am unable to check that now. Okay. Check. Some problem with the. Okay, we'll move to the next. One new skill to learn. Something you want to learn. A new skill. Change self-pity, change, spend some time play for myself, palliation, palliative care, music, driving, maybe knitting, learning new skills. Binu Thomas, okay. Who will help you in distress? When there is a problem, some confident person must be there. Then maybe you may be able to share some confident or some stressful situation with someone. Who will help you? Any response? Self, family. So the sharing, you know, it's better to always be encourage people to share their worries or problems. When the problems are shared, it will, the severity will come down. When the joy is shared, it will double. So that's the usual way of encouraging people to communicate. Senior wise people, my children and friends, family, colleagues, family. We should encourage our patients or even students to have at least 5 people who can communicate confidently, relatives, neighbors. So even though there are stressful situations, the social support is very important. Whenever there is even though we are going through a difficult situation, if there are people to support you, you can reduce the impact of that stress. So there is a message by encouraging people to find connections in the society. So during the COVID time also, the 2 words which helped us to survive was compassion and connectedness. So the compassion, that empathy with understanding others' problems and connectedness. So if you are asked to scale your skills in mental health, the psychiatry or mental health issues, dealing with mental health issues in your palliative care patients, in a scale from 1 to 10, how will you score? If there is a measurement scale to assess your competency in mental health, address the mental health issues of your palliative care patients, how will you score? 5, 6, 6, 5, okay. So wherever you stand, the recommendation is what are the steps to how to improve 1 point up. How can we improve so this is the discussion. So mainly in the coming 1 hour, we will discuss how to improve your thing. Then expectation from, what are the expectations from your today's presentation? I just want to know your need, any specific need, and discussing any queries to answer, or any point you have to clarify in palliative care, or any problem you have seen, so that I will get some idea. Otherwise, I will be just describing my own slides. So otherwise, we can include your points in the discussion, and I can modify the discussion in that lines to become more aware about the topic. Okay, I wanted to learn mental health issues and management. Jarala Srinivas, Jarapla, Abhijit. Okay. So I will try to do that. How can we give early intervention? That is very important. But I'm also very much interested in early intervention. We work in school mental health program for last 10 years in Kerala, mainly for early identification, early intervention. Okay. Okay, so we'll go. I will show some of these slides, and in between we can stop and discuss. So must be knowing this. Can you identify this flower? Any name? Lotus. Yes. This is called. There's a special name for this. Cyan ruby lotus. The plants, garden, green. Green is very good in reducing stress. So try to at least keep a green, small plant inside the room. That will reduce the stress. These are, even though the wild kind of plants, this will bring a lot of joy, greenery, with less maintenance cost. This is, again, you must have seen this. The different phases, no? When you communicate with patients, this will also give some, we can use the symbols, no? The different phase, time of the day. Again, next day it will be happily with a lot of beauty. So this will, the difficult times may not last for a long time. For our patients, cancer patients and palliative care, it may not be true. Still, for example, for a severe pain, we can offer something to reduce the pain, and we can be with the patient and give some hope. So that's the one which I'm trying to communicate. So my association with, this is my wife, Dr. Indu, she is in community medicine. We were with Pallium associating for more than 10 years, and sir came to our college, medical college, Trivandrum, conducted workshop, 10 days workshop. And for medical students also, we are trying to introduce this palliative care. And we could visit the field during our palliative care training. And so the point is, we are dealing in palliative care, we are not cancer alone. There are other cases also. In our medical college, there is a pediatric department. There we are running pediatric palliative care. You must have visited pediatric palliative care also, chronic patients, children with rheumatoid kind of illness, mental retardation, autism. This is a case admitted in Pallium, India, in the previous campus. So TAO with severe pain and waiting for amputation. The pain was 10 by 10. So he was not sleeping for many weeks because of the pain. There was nobody. So more than the pain of the leg, the pain was because there was nobody to take care of the person. So after admission, his pain came down and he was very happy. He was a smoker. So I think in the case discussion also, the same similar scenario was there. Because of the smoking, lot of guilt, depression, and even suicidal ideas because of the severe pain. Old man, 85 years with catheter, multiple disability and all, CBA. This is a patient we saw during our field visit. Actually, we went there for visiting an old family, husband and wife, 85, 90 plus disability. But this young man, some youngster in that family with schizophrenia, chronic mental illness, not getting treatments, sitting and muttering. He was unable to look after the older parents. So we started medication. So in psychiatric problems will be there in our palliative care patients. Almost all will be going through some sort of mental health issues. And in your field visit, you may get pure mental health problems like schizophrenia or even dementia or mental retardation, autism. Such cases are not getting any treatment and in the community. So we should be able to offer some relief to the patient and family members. So the isolation, this is the most important or the serious problem, getting isolated from the community, family, loneliness. So that we should do something to reduce the loneliness that may result in severe depression and anxiety. So in mental health, we have to consider the entire life course. This is a new kind of, there are two new concept I want to introduce. One is the life course approach from early, when pregnancy, postpartum, the mothers are going through a lot of stress, depression. When in neonatal early life, up to 2 years, 3 years, there are behavior, emotional issues. Childhood issues are increasing. Lot of substance abuse, screen addiction, youth or the adult reproductive age group or youth, then elderly. All the phases of life, there is a risk for mental health. Bottom line is, along with physical health, we have to look into the mental health and social health. And this is from a recent Lancet publication. There again the same stress. They are stressing on the same thing, that is nature and nurture. So our brain, that biology is important, but the social factors are also important in precipitating mental health problems. Social determinants like education, poverty, or other issues, physical health. For an adult, when we are dealing with cancer and chronic illness, these chronic physical problems like pain or other, then social exclusion, financial insecurity, all of our patients are going through these sort of social issues. So that may precipitate in a biologically vulnerable person either depression, maybe drug addiction or other issues. So the drug, by giving a medication, you may be able to correct the changes in the brain, but the social issues also should be addressed. This is another thing. In one response was that the mental health, the patient may present with worry, lack of energy, insomnia, slow thought, anxiety. There may be silence, not talking, low mood. And in this early stage, we may not be able to make a definite diagnosis. Most of our patients are going through the early stages and finally withdrawn and maybe a syndromal diagnosis of anxiety, depression. So there are scope for improvement or involvement at the early stage. So this is very important. There is a staging of mental illness, hallucination, then finally mood symptoms, depression, psychotic symptoms. So we may get a referral or an intervention at a later stage with a definite psychiatric diagnosis. But there should be an intervention at the identification and intervention at an early stage. So that will reduce the burden, and also it is easy to intervene at an early stage by simple techniques in the primary care without referring to a psychiatrist. Referring to a psychiatrist is always a stigma producing thing. So the focus should be on the mental well-being. And in a symptomatic patient, we have to plan something to prevent the person going to depression or anxiety. So that should be our goal. I hope some of you might have seen that World Mental Health Report was published recently, last week, by WHO. This is mainly to inspire people, especially working in this area of health, and inform about the importance of mental health and change our attitude and practice or incorporating the mental health subject in our daily interaction with our patients. So these are newspaper report on the mental health, the World Mental Health Report, the anxiety, depression are common mental illness. Even after COVID, there is a 25% increase in anxiety and depression. There is a lot of economic cost of mental illness. And this is an important point. Even the lifespan may reduce by 10 to 20 years. A chronic depressed patient may lose 10 to 20 years in life because of, maybe that's an average, because of the suicide or the mismanagement of physical illness. For example, even it may not come for a treatment for even chemotherapy or radiotherapy or diabetes or hypertension or cardiac illness. They may not take appropriate treatment. So that may produce early mortality because of the poor management of the comorbid medical problems. So identification of comorbid mental health issues are very important for quality care or the improvement of the quality of life of the person and the family. So that's the significance of the identification, early identification actually. So these are the three areas reported in the mental health report. Mainly the one area is suicide prevention. So all over the world, the suicide is increasing. You must be aware about that. Especially in India, suicide is around 11 to 12 per lakh per year. But in Kerala is one of the state with highest rate of suicide. Sometimes around 3 times. Previously it was 33, now it is 25, 26 and all. So as the living conditions are increasing, suicide rate is also increasing. So the major reason for suicide is depression. So all over the world, the prevalence of depression is increasing. And one of the comorbid that along with all the chronic illness, there is a high risk for depression, especially cancer and that kind of pain producing illness. And the other areas are child mental health and mental health at workplace. These are some figures given in that report to show that magnitude of the problem. This is important to know that the suicide is maximum in the younger age group. All over the world, the second common cause of death in younger age group is suicide, and first is accident. So both are preventable. So the suicide is a preventable death. We should identify that risk factors for suicide, and that is the most important risk factor is depression. So that's the significance of identification. You can see the anxiety and depression. These are the most important mental health issues in the first 10 problems producing disability or years lived with disability. Or when you measure the severity of an illness using the DALI, the parameters like DALI, depression and anxiety are there. And most of the cases, depression may report to us because of the sleep disturbance or the suicidal attempt or severe that kind of severe withdrawal. The anxiety is usually unidentified. They will not come for treatment because of the anxiety. So you have to look into anxiety. Anxiety may be exaggerating their pain and other physical symptoms. So unless you address these anxiety and depression, unnecessarily we will be ordering for more investigation, more treatment, more will increase the dose of drugs again and again. And for example, depression with sleep disturbance, we may be giving a sleep or a sleep-inducing drug without treating the underlying depression. So for a depressive illness, we have to treat depression, not a sleep or a sedating drug. Again, showing the magnitude of anxiety and depression, its contribution to the mental health problems. Anxiety, depression is a major contributor. And this slide shows the relation between the non-physical illness and mental health issues, especially non-communicable disease, HIV, tuberculosis, tropical disease. Here again, the depression is particularly prevalent in patients with cancer. So many studies showed that even 30 to 40% of the patients with cancer are going through depressive illness also, which needs independent evaluation and intervention. And it will produce health impact, social impact, economic impact. And so again, just show the magnitude. So is it possible to measure that wellness? So the initial part of my presentation, I want to stress, before going to depression, we have to think about the positive side, that wellness. What do you mean by wellness? Some of you can share. Please, Sajjan, what is your opinion? Wellness in our patients or
holistic care, like physical, emotional, and overall care.
Is it possible to measure the wellness? Is it something like objective thing? No, is it possible to measure objectively how much?
To some extent, I believe it can be measured, like on a scale questions, scalable point-wise answers and so on. It can be measured.
If I ask you from 1 to 10, where do you stand, your wellness?
I would say 8.
Good. What about Abhijit?
I 7, I would say. Weight is a problem.
Pardon?
Yeah, 7, I would say.
7, very good.
Yeah.
Anybody else? So wellness is important. So one approach is, instead of looking for and trying to fight with the depression, anxiety and reducing this depression, anxiety, we can sit with the patient and discuss how can we improve the wellness, happiness. You can ask, instead of asking about how much you are depressed, ask them how much happiness is there in, or that wellness, whatever way. The wellness, the word may not be, maybe you have to describe the meaning of that word in a language which patient understands. So recently there is a scale published, and I could attend that meeting. One psychiatrist from India produced. There is a website. I will share the website. You can go into the details. It's called Hero Wellness Scale. So you can remember it easily. This HERO stands for that. H stands for happiness. So these are the components they have given in this scale, measuring the happiness and their enthusiasm. Then their resilience. Resilience is one important point, actually something like a life skill we have to achieve to overcome a stressful situation. Then optimism in life. And finally, a global kind of mental wellness. So will you please score this is easier, only 5 items are there. This is the scale, it is available online. You can use it, translate into your language, local language and use it. So the questions are these 5-point questions. The first, for last 5 days, you ask the client or the person to evaluate your happiness or enthusiasm or your resilience. Sometimes you have to explain what do you mean by resilience and optimism and the overall wellness in a scale from 1 to 10. So will you please try to do yourself and add the totals into the total score and multiply it into 2 so that you will get a score in 100. So first question is, for last 7 days, your average happiness in a scale from 0 to 10. Above 7 is highly happy, that 4 to 7 is moderate, and low or a mild happy maybe 1 to 3. So in between you can choose something. It's a subjective, whatever you feel you can score. For first question for last 7 days for happiness. Second question for enthusiasm in last 7 days. Third, resilience. Resilience means ability to cope with a difficult situation. You are on feeling that I am able to cope with a difficult situation. The fourth one is optimism. That's a positive approach and optimism. And fifth one is overall wellness. Please try. We can spend few minutes on that. And I give 1 mark for 1 score for each question, 5 questions, add together and multiply it into 2 so that you will get a score in 100. So it is easy to communicate and understand something like a percentage. Hope it is clear. Any doubt you can ask.
So where would feeling satisfied or a sense of fulfillment come in this? Because you do some work and you're very happy with it. So I mean, in this you're satisfied with it. So where will that come?
Here now the maybe happiness you can use. This is actually it is only 5 items. All dimensions may not be included.
Right.
This is after research they have is made into a symbol. There is another scale available by WHO wellness scale. That is again 5 items are there. This is a different kind of. You can use whichever suits you. I think this is more. I find it useful, more simple compared to WHO wellness scale. That's why I use it.
Got it.
Sir, this can be used for the general wellness, you mean to say?
Pardon?
This is for only cancer patients, or this is for general
wellness, not specific for cancer patients. This is for general wellness they are recommending. General, you can use it for your patients and also you can try. I think if you are, some of you are interested in maybe research, you can do some research using this scale, translate into your language, and also use the for comparison, you can use the WHO wellness scale also. I came to know about this recently, and I have started using for our medical students, our school students, and our teachers. So they are easy to understand the concept. That is actually the assessment is mainly to introduce what we can do to the what we can do or change. How can you improve the wellness? So it is actually something like a basement or something like a baseline assessment. There is no cutoff. Wherever you stand, we recommend them how can we improve. From probably our target is you should be in a 70 to 100. This highly with the upper limit. So if you are in the lower thing, we have to recommend them do some activity to. So there is a certain 76, 70. You are all highly satisfied people, and wellness is there. Okay. So the next part is just to improve how can we improve that. So that's all. How can we improve that 80? What recommendation you will give if it is 50 or 40? Definitely our patients may be in the lower range, unless they are very positive and in a better, especially we expect like most of our palliative. That's why I'm recommending. I have never used for as a research project in our cancer care. And the last palliative care training for our 30 days care training I have used for the participants. That's all. Some of the participants were scoring very low, even 30s, 40s. So the discussion was based on that, how to improve that. So what suggestions you can give to improve the happiness or wellness? Hello? Do things you love or try something new, example, drawing, painting, writing, poems. Yes, that's why it's very important to understand person's hobby, maybe his skills, his achievements, past achievements. Based on the scores, try to address the component. Component wise, we can address each component. We can get in touch with all the friends, getting that connectedness. That is very important. Practicing gratitude, very good. So that is another way of thinking that there are good people, there are people to help you, there are resources available, and need not be lonely. So moving out or some, when nowadays we can use a video call or connect through the social media, whatever gives you happiness and motivation, do that. So that is why you have to sit with the person and listen to him, his happy moments in the past. What are the things which give pleasure? Small things, maybe a pet dog, a cat, or a plant, as I said earlier, a flower. Maybe the person may be interested in gardening. So we can encourage the person to do some activities. Okay, whatever gives you happiness, learning new skills, gardening. Learning new skills always improve your brain connectedness. The neurons, even in old age, that prevent deterioration, the dementia kind of thing. It's even neurologists recommend use the brain, use or lose. So that is a usual teaching. So we'll move forward. So okay, this is the scale in Malayalam. It's moving now. So this is just so that we recommend a person to be above 7 to 8, 9 in each domain. There is we can say it is maybe mild to moderate, severe, or minimum, or the moderate, something like that. So we must be very careful when the person is less than 3, that 30% or 3. You have to look for specifically depression or severe anxiety, or need not be due to depression alone, maybe due to pain. So anyway, the person needs some help. So we have to try to improve the happiness or well-being. So instead of fighting with the depression, reducing the depression, we are working from the other side, the wellness side. So depression and anxiety is considered as a wellness disorder, a deficits in wellness. So all of us need wellness, or along with that normal physical health. Mental health is also important. Positive mental health. So positive health and positive mental health. For that, we have to move forward. So this is a slide we use in schools for communicating that happiness, well-being concept. In schools also we use the same model, because previously we used to go to the school and trying to identify children with drug addiction, screen addiction, violence, aggressions, scholastic problem. Now we are talking in terms of who are the children who need help for concentration, help for control of anger, anxiety, and all. So those who need happiness, or how to improve your wellness, how happy learning, what we can do together. So we are taking child, parent, and the teacher together, and we are working towards a better future. So moving in a positive way, that gives a hope or connectedness or working together, a team is built to move forward. So there is something all of us should do. There is a sharing of responsibility also. So same paradigm I think we can use in anyone, all of us, that physical health, mental health, social well-being. There's physical well-being, social well-being, and also the values, goal, and meaning of life, then hobbies and all. So these 4 dimensions are important. And all of us are aware that for physical well-being, we need to be physically fit and strong. For that, we have to recommend regular exercise, good sleep, and eating, drinking adequate. So all these things are simple, common sense. All of us need. Our patients also need adequate sleep, food, nutritious food, and exercise. Even though there may be limitations, encourage some physical activity. So it's very important. And for psychological well-being, there should be some leisure activity. There should be focused concentration, social well-being, getting connected to family, friends, and all. And for if there environmental well-being, that's also very important. Somebody mentioned about the gardening. The environment is also very important. A pleasant environment is very important. Open spaces. Financial well-being also important. Income is required for basic needs. Food and shelter is important. And occupational or educational well-being. So all these dimensions are important when we assess a patient with even any person for a normal life. All these things are important. So how to improve wellness? So we discussed some points, and in the as a capsule, as an intervention package, we recommend something like just remember the acronym NEST. NEST means nutrition, healthy diet, E for exercise, and sleep, adequate sleep. So then time with your family, friends, maybe nature, and also mind. There was a response, and spend some time for your mind. There we can include some meditation, mindfulness technique. Now there is a lot of evidence or the importance given to mindfulness. Mindfulness is a simple technique. Actually, it is based on Buddhism, Buddha philosophy and all, taken by the Western people and then remarketed, or in a new bottle it is there as mindfulness. But it's a simple way of giving attention to the present moment, an active, non-judgmental approach to the present moment. So there is a lot of literature is available, techniques are available, so you can look into that. So may not be suitable for all the patients, for even a mindfulness or a yoga. So whatever suits a patient, you have to tailor-made some solutions. You have to discuss with the person and encourage some positive movement which may change. So always the discussion should be, if you are stating that the score is 5 or 6, what we can do to improve 1 point up from 5 to 6. You are not discussing about 10 first. We are discussing how can we improve a small change or make a small change in life by simply going out and sitting outside in the garden for half an hour, or chatting with a friend, old friend, or something like that. Small change which is relevant for the person. So that way you can work on that. Okay. So this is that from the website. They are recommending practice this thing for next 30 days. For example, exercise, 30 minutes exercise for 30 days, and again, you can score and show that you are improving. Mindfulness, do some practical mindfulness technique, at least 10 minutes per day, continue for 30 minutes. So whatever thing you are doing for at least 3 to 4 weeks will make a habit. So try to introduce these techniques. Sleep. So there are techniques, sleep hygiene techniques are there. So practice 4 or more sleep hygiene techniques for next 30 days. I hope you are all aware about sleep hygiene. There are a few slides on that. Social connectedness. That connecting. So meet or call a minimum 2 friends or a family members each day for next 30 days. So these are simple things without much expense we can do. Nutrition. A healthy diet we usually recommend this kind of my plate, the half of the plate with the vegetables, and 1/4 with the grains and 1/4 with the protein. So this is a simple way of, again, communicating with the children. These pictures are very useful. Any comments on this? Your experience or any suggestions?
exactly this is what we need, sir. When we don't follow these only, there is a component which creeps in and which disturbs the wellness. Definitely, if you follow this, then it would be good. Good input, sir.
Okay, thank you. Any more response?
So do cancer hospitals have a wellness department of some sort, or do they pay attention to these things? Because the ones which I visited, generally the atmosphere is very depressed. So what do the cancer hospitals do about it?
Actually, all the cancer care centers, there should be some mechanism to address their emotional need. So instead of identifying the problem, you have to think about how to improve the wellness. So that may be a better way of acceptance by the patient and family members. These are simple common sense, but it will make a big difference. Unless there is a physical health is better, the mental health may not be. So we have to, it is difficult to separate. This is physical health, this is mental health and all. Then social health. So we have to, this is a total health concept. So the total well-being, positive health. So that way you have to educate and incorporate in the, when cancer care, palliative care and all. So it should be something like a package, a wellness package. So the exercise which is possible inside simple things. There is a recent research, even exercise will improve the even brain functions. When at the age of 70 years, this is a study, the age is 74 years. Participation in 24 months physical activity program was associated with larger hippocampal volume. So even at this later age, old age, this will produce improvement. This is, I usually show the brain when we discuss mental health. In mental health, actually, we are dealing with the functions of the brain. It's also part of our body. It is nothing alien or nothing different. It is all the thinking, the emotions, everything is taking place inside the brain. So it is part of our body. So the neurons are important. So by doing the simple physical activity will change. Even can prevent depression and anxiety. Physical activity will improve the endorphins and that happy molecules in the brain. Even sleep, adequate sleep will improve your brain functions. And even the poor sleep will produce brain atrophy, even cortical atrophy. So sleep hygiene. So these are the usual recommendation we tell our patients. These are available online. Same time going to sleep. Sleep disturbance may be there because of the pain and other conditions, but you have to identify that physical problems or depression. The most important, that is why it is important to differentiate. If there is a consistent sleep disturbance for more than 2 weeks, you have to suspect depression. When in the absence of other issues, pain or other problems, the person is unable to sleep for more than 2 weeks. So sleep disturbance is one harder or a easy thing to identify for even a general practitioner, a common person, a family member. Depressed mood may not be able to communicate because of the always may be taken as a part of the illness. Cancer patient will be depressed. That is the usual. So we are talking about a major depression, which is a serious problem. This should be treated. Otherwise, the person may commit suicide. The cancer may be curable. The colon cancer or a CA breast at the early stage, we can treat. There may be 100% recovery from the illness, but because of the depression, he may commit suicide. That functional, that disability will be exaggerated. So that's why this identifying the sleep problems are very important. And initial phase always recommend, instead of going for any medication, sleep hygiene should be recommended at the initial phase. Okay. The relaxation, and again screen, restriction of the screen towards the bedtime, that's also very important. And this is another website giving lot of capsule tips for improving our happiness. You can visit this Action for Happiness website. So they are giving package, something like a great dream. This is again a different way of looking at happiness. So happiness by giving, do things for others. Actually, while working in palliative care, we are deriving some happiness by working or helping other patients to relieve their stress. Relating, getting connected, same thing, getting connected. Exercise will also reduce stress and increase happiness. Awareness is the one that mindfulness, meditation, and spending time with the nature and all. trying out something, keep learning something new. There was a response from the participants. Keeping on learning something new, that will improve your happiness. Direction, having a goal, some dream or goal to look forward, that will reduce your stress or improve the happiness. Resilience, again, the ways to bounce back. Emotions, look for positive emotions in life. Spending time with children, grandchildren, your pet and on. Acceptance, be comfortable with what you are, and sometimes you have to accept that cancer is there, it is a reality, we are treating it, you have to go through the chemotherapy or whatever is, you have to accept it, it's a reality. There is a treatment available. Sometimes it may be incurable, it may be with a secondary later stage. Still, we can reduce the pain and we have to move forward. There are people to help you. So that way, sometimes it is also a way of life. We have to cope with it, the resilience and accepting that thing. And meaning of life, be part of something bigger. Even with illness and all, we can part, as some of the participants said, we are working to reduce the stress in the society or the wellness of the society or the better care of our palliative care patients. So we be part of a common, maybe something great, or the maybe a common issue, something like an environmental protection or school mental health or the gender issues. So some area of interest is important. Okay. So this is again showing the same thing. Okay. So this time, any thoughts? So this is, yeah.
Since I come from the Christian fold, the church ministry,
Oh.
one of the important things is healing of relationships, which is this forgiveness or needed, or there is need to reconcile, or sometimes resolve some regrets in the past. So what do you think about that in terms of wellness level of happiness?
Yeah. Religion, actually, all the religions, Hinduism, Muslim or Christian, all the religions were helping us from early years for relief of stress and coping with, and giving some relief in difficult situations in different ways. This prayer, this chanting, and when Bible, that verses in the Bible, I used to read Bible a lot during my college days and all. It was giving a lot of relief during our stressful situations. So similarly, other stories in Ramayana, Mahabharata, and all these. So depending on the person's belief and the cultural background, education, we have to modify. We may not be able to give advice, give some prescription to reduce his stress. We have to see. That is why this listening and sitting with the person and understanding his values, his views about the life, his support, his meaning in life. What are giving small happiness? Maybe just spending time with that his old friend or something, maybe giving relief. So from the past experience, so he is coming with a lot of experience that we may not be able to understand in a short period of life, time. So it is always listening to the person and try to encourage. In solution focused therapy also, it is again, one of you suggested the detailing. Sajan said about that. So listen to the details of his positive things in life. Ask him to elaborate the happy moments. How what was his happy moment? The happiest moment recently. Elaborate. What was the scene? Describe the scene. Who were there? What was the mood? What was the color? What was the color of the sky? What was the maybe temperature? Details of that. Elaborating that positive moment, that will give some relief, and that will give some idea that is it possible to recreate. So here the solution focused approach, we are telling that the resources with you, you could do it. So it is possible to do it again with the resources available to the extent possible, with all the limitation for your physical illness or the with the treatment or other limitations at this age. There are possibilities which we can. So actually, it is called something like a co-creating a better future for the patient. Along with the person, we are sitting and together with the family. And so actually, the solution focused approach is very important for the caregivers, giving more hope. So it will reduce their burden also. we prepared a presentation and presented in international this cancer care conference on the solution focused approach in caregiver reducing the burden.
Right. Thank you.
Okay, I will go to that second part, the stress, depression, anxiety, and we will open for discussion. So stress is good at some extent, but severe stress will reduce our performance. So that's why it is important. So anxiety, we can consider it as a wellness deficit. Anxiety may be different types, maybe fear of insects, strangers, so they may be called specific phobias and all. All of us may be going through, even fear of illness, but fear of cancer may be there for normal people. And social anxiety is the anxiety in a social situation. There are other things, specific things, OCD. OCD is called obsessive compulsive disorder. That's recurrent thoughts coming to our mind, which are irrelevant. Patient is aware that it is irrelevant thoughts, but he is unable to control. It will produce a lot of anxiety, and he may be going for washing or checking and this repeatedly doing. These case persons severe anxiety, panic attack. This panic attack is severe anxiety producing palpitation, giddiness, something like a chest pain. Maybe we may think that person is going through a heart attack. Young person, 30-year or a 15-year-old boy or a girl may present with symptoms of severe sweating and giddiness and pain, similar to something like a cardiac problem. ECG may be taken to casualty, and ECG, everything will be normal, but these symptoms are there. The person is suffering. Because of this problem, he may not go out. So this is called panic attack. Such cases, they have to give some medication along with other counseling, support, relaxation techniques. So such cases should be identified and referred to a mental health professional for further evaluation. Sometimes there may be an underlying problems like thyroid. Hyperthyroidism may be the reason for the anxiety. Some of our drugs, cancer patient, the person chemotherapy drug may produce this depression or anxiety. And so always beta blockers, the antihypertensive drugs may produce depression. The steroids may produce the depressive symptoms. Even manic, certain patients may produce mania. I do get referral from the RCC in Toronto, here the Regional Cancer Center. When children are referred to our clinic, we are running a child psychiatric clinic, and we get from pediatric oncology, we get cases of mania induced by a high dose of steroids. So we have to treat a mood disorder, that aggression, violence, sleep disturbance, and over talkativeness. So the certain medication may produce or precipitate mental health issues. So depression. Any personal experience to share? The one case you have seen depressed, or anyone? Usha madam? Or Vinutha madam, any experience or depression? Hello? Your micro mute, you are muted, madam.
Yeah. I had one patient with CLM, and daughter was the caregiver, and whenever they used to visit our center, I felt they were like she was too much involved with her caring with her mother, and both of them were looking very much depressed. So I spoke with them, and I'm not very much good in counseling and all, but when I spoke with them, and when family counseling was done, so we could able to resolve, and I was able to convince patients that frequent visit. When last IP visit, she saw one of the patients in our IP dying. So she was worried that she will be breathless, and it will be difficult for her daughter to look after at home. So she used to insist every now and then, every alternative day, to come and get admitted. So somehow it was solved by counseling, and now patient is being taken care by our home care team. So I feel like depression is a major thing which plays a role in, especially for caregivers. That not only affects patients, it affects the whole family.
Yeah, there is a merger.
family and friends.
When the person is depressed, distressed, unable to sleep, refusing food, the entire family will be depressed. So,
Yeah.
so you have to
Yeah,
talk to
yeah.
the family and convince
The
the.
daughter had one small daughter also. I mean, the patient had granddaughter, and her husband and her daughter was looking after her. And somehow it got resolved. And our home care team is going and visiting them, and oxygen is being provided with air beds and all, whatever possible way we are trying to support and help them. So they are more comfortable at home than frequently visiting hospitals.
Okay.
Things can get resolved by counseling.
Okay, mild cases, maybe you can counseling and patient may improve. But in severe cases, maybe severe means severe with sleep disturbance, suicidal ideas, you have to refer to depression follows by stroke. Okay. Severe cases, the person should be referred for a mental health evaluation and to a psychiatrist also, because they may need medication, drug treatment, because the severe depression is due to changes in the brain. There is the reduction in the serotonin. Serotonin is the molecule which is giving happiness. So there is a pathology now attributed to depression. So we give drugs which improve the serotonin level. So it's called SSRIs. We give fluoxetine. These are called antidepressants. So nowadays, newer drugs are there with minimum side effects. And if the sleep disturbance is there, we can give some medical drugs for sleeping tablets, something like a benzodiazepine for a short period, 1 or 2 weeks. But you have to continue the antidepressants for another 6 months to 1 year. That is, the duration is important. It is not like a treating with an antibiotic. Even the action of antidepressants may take 3 to 4 weeks. So even after improvement, we have to continue the antidepressant. It may be a simple capsule. I usually teach them that, or educate them that this is something like a vitamin capsule, which will give more energy. It will reduce your stress, it will make calmness, it will quieten you, improve your thinking process. So for a better functioning, they may need support. So these drug will help you to sleep, a good sleep, good concentration, calmness, happiness, good appetite. So you can go for work, you can continue your activity, you can play with your children. Otherwise, all these functions will be affected. Your personal life, family life, even you may not be able to go for treatment. So that way you have to educate the person and convince that need of a medical treatment in severe cases. Okay. So this is the burden of depression. Actually, depression is in developing countries, high income, low income, all the countries, depression is now increasing. After the COVID, it has increased 25 times. I think 25%, sorry. And you can see that it is more in younger age group, these 20s, 40s, 30s and all. The age group distribution, and even old age is there. And it is a major cause of suicide, reason for suicide also. This is one data from 2017 to I think 1990 to 2017. That is increasing rate of depression before COVID. And now after COVID also there is 25% increase. This is a report by WHO. It is written in Malayalam. The news is that there is all over the world anxiety and depression increase after COVID. This is one patient referred from cancer center to our OPD, a 46 person. He was using this ADS, means alcohol use disorder, alcohol dependent syndrome. He started alcohol from 15 years. Now recently started pan masala for 4 years. He attempted DSH, means deliberate self-harm. We usually write, instead of suicide attempt, we write DSH. DSH means deliberate self-harm. That's harming deliberately. So he was referred, he is a cancer, I think larynx. He was unable to swallow, there were else to feeding, severe pain. So he attempted to commit suicide multiple times. So without sleeping, pain, distress, and all. So that's a case of depression because of all the sufferings and all. So we treated depression, he improved, and he was referred back. We continue treatment. So in such cases, we have to assess and give the treatment for depression for a better outcome. So I will just summarize. There is not much time, so I will just summarize 10 points which are important in depression, and I will stop the presentation. So the first point is depression is going to be the major cause of disability by 2030. So this is studied by WHO. Currently, it is second or third. Now, by 2030, another 10 years, all over the world, it is going to be an epidemic or a pandemic. Like it is more severe than COVID with mortality, morbidity, and all. And for making a diagnosis of depression, to differentiate between a simple sadness and depression, the person's symptoms should be there for 2 weeks. So if the person is unable to sleep for 2 weeks, unable to concentrate, crying spells, or unable to go for work, some of the symptoms may overlap with cancer related to pain or in cancer. But then you have to differentiate these always negative thoughts about the suicide, the hopelessness. So that may not be there because of the pain. Pain and cancer, it is understandable and we have to treat it. So even with that treatment or the cure offered, the person is always withdrawn, not talking, reduced activity, not sleeping, not eating. So we have to suspect depression. That symptoms lasting for more than 2 weeks. So that is important. Third point is most of the cases are undiagnosed. Only 1/3 of the cases are getting any, because most of the time we may think that this is part of cancer or illness or the pain. So they may not consult or communicate that even there's that sadness or that suffering because of the anxiety or depression. So we have to specifically ask for that symptoms. If time permits, I will discuss the diagnostic. And the risk for getting depression is 1 in 4. These numbers are just to remember. 25% of the, actually 25% is the risk for females to get depression in the normal population. In the cancer care field, it may be more. 1 in 4 for females and 1 in 8, maybe half of the thing for males. More in females because of the hormonal changes and their multiple stresses and all. It takes only 5 minutes to make a diagnosis. We have to look for, there are as doctors or psychiatrists or a psychologist, mental health professionals, they use a diagnostic criteria by WHO or American classification is there, DSM. So out of 9 symptoms, they have given 9 symptoms. In psychiatry, the diagnosis is mainly based on clinical features, not based on any lab diagnosis, scan or blood test. This is subjective. We have to discuss with the patient, listen to the patient, listen to the family member, caregiver, and then only will make a diagnosis and whether the symptoms are producing disability or the affecting the daily function. So based on that, if you listen to the patient for 5 minutes, look for the 5 symptoms lasting for 2 weeks, we can make a diagnosis. So without spending any money, just listening to the patient, you can make a diagnosis and save the life of the person, family. So that is the beauty of making a diagnosis of depression and treatment. Regarding the treatment, we have to continue treatment for, as I said earlier, the acute stage of treatment is for 6 weeks. That is for the improvement of symptoms, we have to wait for 6 weeks. And we have to continue the drug treatment for at least 6 months. So that duration is important. Most of the persons stop the medicine after improvement because the continuing the psychiatry consultation and treatment is a stigma producing. So going to the pharmacist and getting medicine also. And patient may think that this is a self kind of weak person get only depression. This is a normal. Anybody can get depression. So continue the treatment for 6 months to 1 year actually. And if there are multiple depression, you have to continue for a long period. And the suicide risk, 1 in 7 will commit suicide. There is a 15% of the patients, actually 50 will get the negative thoughts and suicidal thoughts, and 1 in 7 may commit suicide. So like heart attack or cancer, depression is a medical emergency. So that is it should not be taken lightly. So that much is the suffering for the person. He may be thinking that I am worthless. It's a burden to the patient, family, and I am not productive. So there is no point in leaving. So this thinking is part of depression. So that should be identified. If there is some sign of low mood, and we have to positively ask about the suicide. By asking about the suicide will not precipitate. Actually, it will reduce the chance of committing suicide. So that shows that you are able to understand his burden or his sufferings, and he is getting an opening to discuss that point. So then the chance will reduce. So always discuss. You will not directly jump into that question, but you have to prepare, spend time, and that in that one-to-one confidential relationship, when the rapport is good, the person will start communicating that worthlessness, that sometimes the thoughts of the meaninglessness, and thoughts of that going away or committing suicide, and his attempts or plans. So gradually you have to come to that question. And the positive thing is 80% will improve with your intervention. So that is a good thing. You need to refer to a psychiatrist only in 20% of the cases. So most of the cases, I am talking about even severe depression, which are treated by medication, drugs. Certain cases may be complicated because there are different types called psychotic depression, bipolar depression, or depression with severe family pathology or other social issues. Such cases may be referred for multiple intervention by psychiatrist, psychologist, social worker, and all. But most of the cases you can treat. So along with your pain palliative care intervention, you give one tablet of antidepressants. That will make a big difference in the life of the patient and family. And there are 9 clinical features in this diagnostic. This is called DSM, Diagnostic and Statistical Manual. This is an American classification, very simple to follow. WHO is little explanatory, and we have to read more. And the DSM is American classification, simple. You can just count. There are 9 features. Out of 9, if there are 5 features, you can make a diagnosis. When a counselor or even a palliative care worker can make a diagnosis. And 10th point is, it is 10%, it's common in all age group. In the community, 10% of the persons are actually suffering. 5 to 10% are suffering from depression at a point of time, and different cultures, different age. And there are, in ICD, there are 10 features. So this is just, I usually used to these numbers to teach our students to remember the 10 points on depression. So that's all. Okay. Any questions on this? Hello. Any questions, clarification? Yes.
So what are the social factors, according to you, because of which a lot of people are turning depressed in our country? What do you think? Any comment on that?
Actually, the depression, we have to consider it as a multiple factors. Like there is a biological final common pathway is changes in the brain. That is, there is a reduction of serotonin. That may be biological. That may be a hereditary kind of like a diabetes or hypertension. Some persons are biologically vulnerable for the depression. But such persons, when they are facing a stress in life or a stressful situation, like a diagnosis of a cancer or a job loss or a stress in the family environment or some stressful situation, it may precipitate depression. Okay. So there is biological and social, psychological factors are important. Our personality is also important. Some people are very strong, resilient, they can cope with whatever problem. Some people are little, our personality, we usually call type A or other type of personality, we are anxious. That kind of difficult to cope with difficult situation and all. So they need more support. So that's why drugs alone will not work. Along with medical treatment, medicines are given to correct the biochemical abnormality. For example, for diabetes, we give insulin or drugs to that correct the glucose part of it. But you have to recommend for diet, exercise, and you have to educate the family for that, how to take care of the diabetes. Similarly, depression also, severe cases, you have to, along with the medicine, you have to support the persons, that psychological support, counseling, relaxation, sleep hygiene, and spending time with the family, social support, all these things are important. So it is again that biopsychosocial model that is very important in assessment of all mental health issues, especially important in depression. So there is a positive thing, we can prevent depression. Prevent depression by anticipating its possibility and that thinking about wellness. So that is why that wellness concept is important. So encourage to keep that positive mental health and wellness in all of us, especially in our patients who are going through the difficult situation. So that way we can prevent a healthy, that adequate sleep, adequate nutrition, adequate physical activity, relationship, all the activities we discussed, that something like a nest. So the keeping our wellness or positive mental health, we can prevent depression or anxiety to some extent. But if it is affecting and his daily function, sleep is impaired, he is unable to cope, we have to specifically address it as a medical emergency and offer treatment. So that's the message. Hello.
So there's a question in the chat. Manat asks if you can share the pediatric mental health case in palliative care with them.
Pediatric mental health case. Okay. Manas, will you please elaborate on that? Do you want the details of it?
So like as we talked about the wellness in adults and all, is there any case that you have seen like a pediatric age group, if a child is having any mental health issues while being in the palliative care?
Okay. But actually, I'm basically a child psychiatrist. I'm trained in child psychiatry from NIMANS. So for last 10 or 20 years, I am running the child psychiatry clinic in Medical College Trivandrum. So we get a lot of referral from our Sri Chitra and our RCC. Whenever there is a problem with the mental health issues, they are referred to us. We get severe cases of depression, suicidal ideas, and suicidal attempts, even children with problems, behavior, anxiety symptoms are common. Anxiety may not be identified and referred most of the time. Panic attacks we do get. Depression and psychotic symptoms may be there. Mania, many cases with the steroid treatment and chemotherapy, and independently also the positive thing is the RCC here in Trivandrum. The patients are coming even from northern part of Kerala, other parts of even Tamil Nadu. They come here and stay outside the hospital for 3 months or 6 months for the chemotherapy and other radiotherapy. So whenever they come for the RCC follow-up, they come to our OP also for the follow-up. So the follow-up is maintained and we are able to offer continuous treatment for 3 months, 6 months and all. So with the regular follow-up, we work with the pediatric oncology team also, and even Dr. Prashant is in palliative care. So in palliative care also, our postgraduate students are posted in palliative care for previously before COVID, they used to post for 1 month, even in Pallium India. Now they go for the field visit along with the palliative care team whenever they identify cases. So there are cases, but usually the identification and referral are less. It is less than what we expected. So we have to look into it positively. All the palliative care team or cancer care team should also look into, because of the crowd or burden of work, this mental health part is ignored actually. So they are not getting adequate time. So at least there should be, as Abhijit suggested, there should be some mechanism to, or you have to entrust somebody to listen to them and assess this. Screening is possible. So self-administered screening tools are possible. If time permits, I will show some tools also. Now, how many minutes are there? I think Pallium and the team, 5 minutes, 10 minutes.
So it's almost time. So if anyone has any questions, they can raise it up at this point. Or we have 4 more minutes left, to be specific.
Okay. So I will show a few slides for intervention also, and I will stop from flowchart for intervention. So have you heard about psychological first aid? This is by WHO, psychological first aid. This is the first thing we can offer if you are suspecting a depression. So look for the need. What is the need of the person? Maybe pain or sleep disturbance or some other issues, maybe away from family. Then listen to the person with your heart. Here comes the communication, listening skills and all. And then link. You may not be able to solve all the problems, but you can link to the available resources, services, locally available. So this is very easy to remember. Look, listen, and link. Details are available in the website. It's called psychological first aid. So like a physical first aid, you can give a psychological first aid when any person in distress, anxious, substance abuse, or anxiety and all. So this is the model which we are using in our pediatric child school mental health. I think this is applicable to any person or in palliative care also. Here this is a child or a human being. Here is his body, his brain, his family, and we are using the symbol of a kite to represent the mind. Here so we are looking at the skill. We start with the positive thing. So in the palliative care also start with the strength of the person. Then you look for whether the person need any help for his behavior control or behavior issues. We can score 0, 1, 2, 3. If there is no need, 0 or mild 1 or maybe something more 2, and maybe severe or acute intervention 3. Then this is called basics. So I am showing that B for basics, A for emotions, then affect. Emotions are technically called affective disorders, affect. Then S for somatic, so the body symptoms. Then I for interpersonal, that family related. Then finally, this is the cognition or thinking. So these basics, behavior, affect, somatic, interpersonal, this cognitive. So instead of looking for problems, we are checking whether the person needs some support for behavior, emotions, your physical symptoms, or interpersonal, family, social issues, or his thinking process. Thinking process means is a simple education explanation about the illness or thing. So we can just, this is basic, we can give the score. If the person is getting score more than 3, he has to be referred. So this is another paradigm we are using, that kite means understand the person's strength, involve whatever his resources are available, and then give the person some training on breathing or relaxation. Then evaluate. A regular follow-up and evaluation is very important. This is the flow chart we prepared for this Ashwasan clinic. In Kerala, we have started primary care PHCs, the treatment for depression. When the WHO declared World Health Day theme as depression, let us talk. I think 2017, we started in all primary care centers, one clinic for identification depression, treatment of depression. That's called Ashwasan. Here we use 4 questions to identify screen depression. Out of these 4, if 2 questions are positive, we can suspect depression. Then we go for confirmation. This is the ICD or WHO criteria. Mild group A symptoms, group B symptoms. Mild depression means 2+2, moderate. I will share these slides and questions with the team, and they will communicate with you, share with you. And then treatment, mild depression, moderate depression. This is a flow chart. For example, escitalopram is antidepressant, 10 to 20 milligrams, sertraline and all. And follow up what you have to do. Then when to refer. If the person, if your diagnosis is not sure, bipolar or suicidal risk, psychotic. So this is a flow chart we use for general primary care. This is in Malayalam. And regarding the mindfulness, there are a lot of evidence. The mindfulness, the solution-focused approach in cancer care. Here the acronym you can remember is, we are framing frames. That is, we are asking about the future. This is the same question I asked during our introduction, our self-introduction. So what are the changes you want? What are the resources available? If a miracle happens, what will be the life like? Then what are the success stories, exceptions? And you have to scale the happiness in a thermometer kind of thing. How will you, the details of the questions will be for palliative care, future-oriented questions. What are the expectations? Expectation may be pain reduction or sleep or something like that. So instead of what are the problems, we are asking what change you want in life. What are the expectations by our consultation, or what are the changes that you like to see? So that one asking about the future. Then what are the resources available? What are your strengths, skills? What are the important persons? Who are the important person? Government schemes or resources available in your community, maybe palliative care, other resources. Then the miracle question is about, if everything gets settled overnight, how will be the life tomorrow? So we have to be realistic based, even with the cancer or pain, we can make some change. whatever possible change, dream, maybe taking a food, taking some sweet, or going out, playing for a child. So you just discuss the dream. Then the exception. Exception means the success stories. These problems are not there 24 hours. There are exceptions, happy moments in life. So mention the situation where you succeeded or happiness or you managed. So you said, so you could do it, so can do it again. So use the same skills. And then finally, the scaling questions. Scaling questions means your ability to handle the problem or your strength or your happiness in the scale from 0 to 10. Where do you stand and how can we improve 1 point up? So small steps in life. So this is the question. This is a picture we are using to explain the questions and all. So I'm not going to this. These are the steps in changing a behavior. For example, smoking or so what is the goal? You ask for his own ideas, use the strength approach. You have to use the language which is encouraging the person to talk. And all these changes are taking place in the social context. Always involve some other person in the community or the family to make a change. So summary, we started with the self-introduction. Actually, in the self-introduction process, we used solution-focused questions. So we discussed importance of mental health and importance in the globally and also in the local, our single patient, how it is very important. It may precipitate or result in death because of the suicide. And wellness is very important. So think from the other side, anxiety, depression, the wellness, the hero we discussed, H for happiness, E for enthusiasm, R for resilience, then O for optimism. So we can use the hero scale for an assessment, especially maybe for youngsters or educated patients, other rural village, you may not. So you have to modify somehow and use the nest. Mainly, this is assessment may not be a major thing. You have for planning for research, you can do for quantification. Otherwise, you try to implement these simple things like nutrition, exercise, sleep, hygiene, and time with your family. Mind, meditation, that's it. So look for anxiety, depression, suicide risk in all of our patients, and these are preventable conditions, treatable conditions. It will improve the quality of life of the person and the family. And solution-focused approach is a simple technique, and these are called third verbs or new verbs in psychotherapy in mental health. And previously, the Freudian and all may take many years or many sessions. Here they are talking about, they're called brief therapies. Even single session or 5 sessions will work. So few sessions we can use this. So framings, future-oriented questions, resource activating questions, miracle questions, exceptions, success stories, and scaling questions. So in between we could discuss, interact. So thank you. My lady is here. You can write to me for any details or any tool or anything. Thank you.
Thank you so much, Dr. Anil, for this very informative session. So one more chance for everyone. If you have any questions, please do ask us now. Or else you can email it to Dr. Anil and he will get back to you, hopefully. So thank you so much, sir, for reminding us on the importance of mental health and wellness, and also the importance of indulging all of these into the palliative care practices. We are so happy to have you. Thank you all. See you all in the next week. Please do fill the feedback form before leaving the session.
Thank you all. Thank you once again. Thank you, Dr. Anil, for that wonderful session. And all of you kindly fill up the feedback form as soon as possible. And thank you.